One of my subscribers brought my attention to the fact that in previous video, I promised to talk about supplements for IBS and I didn't. So let's do it now. Supplements are divided into two big categories. Category number one, that will help to restore the lining of digestive tract, L-Glutamine and butyric acid. And category number two, aloe vera and fish oil, anti-inflammatory. Please try to identify the cause of your irritable bowel syndrome. If you're not going to identify the cause and eliminate the substance that actually irritates the digestive tract, taking supplements is not a solution for the pollution. Taking supplements means that, yes, they will alleviate the symptoms for a little bit, but then the symptoms will be coming back and back. And I will talk more about that. So on the left, you see the normal small intestine, villi and crypts. And on the right, you can see how in IBS there is an irritation and inflammation. Villi are gone, crypts are shallow, and there are 4 sites of inflammation. Supplements. L-glutamine. I usually recommend people, not usually, but most of the time, to take in form of powder because you need to take at least minimum dose, 5 grams per day. Dilute it in warm water and take it as a shot. Butyric acid is a short-chain fatty acid, is made by the bacteria that lives in the digestive tract, and people with IBS often have dysbiosis, or the number of the good bacteria that will produce butyric acid is drastically diminished. So it's a good idea to take butyric acid in form of supplement. 300 milligrams, quite a safe dose, 500-600 milligrams per day, depends on the person and the symptoms. Anti-inflammatory substances. Fish oil. I have the whole video how fish oil is working. Do not expect immediate effect the moment you take a fish oil. It will take 2 to 3 months before it will start to exhibit its anti-inflammatory properties. Aloe vera, on the other hand, will affect the digestive tract almost immediately. And as soon as it gets in small intestine, you will see the effect of aloe vera. It's about 30 or 40 minutes down the road. So this is my contact information, and I coach people if you need me. Now, for people who are watching my YouTube videos for 2 minutes, 52 seconds, we are done. Now, the rest of the video, the explanation, how to actually approach the treatment of irritable bowel syndrome. I said that you must identify the cause of irritable bowel syndrome. So let's elaborate more about that. Suppose person, I'll give you a parallel example. Suppose person has allergy to shrimp. Every time you put the shrimp into your mouth, person becomes red, inflammation all over the body. You have to deal with the symptoms with histamines. And sometimes person actually will do injection using EpiPen in severe cases. So taking antihistamine is not a treatment. It just will help you to deal with the symptoms. The same could be said about irritable bowel syndrome. You put something in the mouth and the body cannot tolerate that, and it irritates the digestive tract, and body tries to get rid of that. That's what the clinical symptom, diarrhea, and then it goes to constipation, and then both diarrhea and constipation. If you will take only supplements, it's not going to work. It's like if you will be eating shrimp and taking antihistamine, shrimp and antihistamine, it's just you are going to have allergy. The same with irritable bowel syndrome. So the question becomes how to identify the cause. Okay, and I tell my clients and told my patients, do 2 things. Number 1, you have to keep a diet diary. You have to write everything that you eat. And on next to that, you write the symptoms, because then you look at this, what you ate, and you say, hey, listen, I ate that and I had the symptoms right here. So you make a connection. Number 2, for 2 or 3 weeks, you simplify your diet drastically. What do I mean? Simplifying your diet drastically. So it will be easy for you to keep a diet diary so you know what you eat. So what means simple diet? You go to supermarket, and you you buy some sort of protein. Protein means you buy either chicken or fish or beef or pork, and it's going to be a base for your stew. In the stew, you can add any kind of grain and vegetables. So vegetables preferably should be organic, because herbicides and pesticides that in vegetables can actually irritate the digestive tract, right? So you can put there broccoli, carrots, cauliflower, whatever, it's your choice. Okra, you put it there right in the stew, and then you add some kind of grain. Also grain you buy in bulk. It could be white rice, brown rice, quinoa, amaranth. It's your choice. And you eat this kind of stew 3 times per day. I recommend people stop drinking coffee and all kinds of teas, because coffee and teas can have chemicals, at least for that 3 weeks. Once when you clean the diet and you see that your IBS get better, and you write that, hey, listen, by the week 3, IBS is almost non-existent, then you start to incorporate into your diet all kinds of different foods. And write it down what the food is, because then you can identify the substance that is in the food. Let me give you an example. Often people have irritation or IBS due to some kind of chemical. Red dye could be in many different substances. For example, herbal tea made of, that red tea with red berries, right? Red dye may be there. Cold cuts may have red dye. And often drugs that people are taking, drugs could be green or red, right? And that the drug is red because red coloring agent is added there. So write down everything. Once when you identify the cause and eliminate that, then the supplements are really going to help. Then you can take L-Glutamine, you can take butyric acid, you can take probiotic, and you will feel so much better. You take fish oil, and you take aloe vera, and you will feel fantastic in a matter of 2 or 3 weeks. Okay, so that's why I want you keep the diet diary, simplify your diet, and then add 1 item at the time, so you will see which food, which chemicals possibly create IBS. Okay, that's it for today, guys. Thank you very much. Like, subscribe. Bye-bye for now.